Many people are concerned about the use of antibiotics in farming. What is the situation at the moment?
Well, in Europe, it is true that we're very often finger pointed. But the reality is that we are doing a lot to ensure that the use of those antibiotics are being reduced in farming, because we know that it is important to keep essential antibiotics for humans available to humans.
And in the veterinary medicine community, what are you doing within your sector to improve the situation?
Well, I think the numbers show that we've been reducing the use of antibiotic and the sales of antibiotic by 32% over not even a decade. That means that we are doing something. And what are we doing? First of all, we created already over 10 years ago a consortium of, I would say, like-minded or stakeholders that are concerned about farming, like the farmers themselves, us, the veterinary medicine industry, and feed manufacturers, to talk about and to implement the idea of as much as necessary, but as little as possible. And it sounds very basic, but it is essential, because we need to continue to use antibiotics in the farming sector, but it was necessary to moderate and to fine-tune the use of them. That's one of the actions. Other actions, I would say more concretely at company level, they are developing other ways of combating diseases, for example, vaccines, or even going now into diagnostics. And last but not least, in view of this Antibiotic Awareness Day/week, we have also a commitment of 25 actions that are being undertaken by 2025, concrete actions in terms of investment, in terms of training of vets, to actually work on reducing the need for antibiotics in animal farming.
We hear a lot about antibiotics being misused by people and by doctors, maybe prescribing them when they're not needed. Does this happen in the veterinary world, in the farming world?
You can't exclude it. But what I'd like to say to that is there's a direct correlation by using antibiotics in humans and resistance of bacteria in humans. It makes sense. It's a direct line. As using antibiotics in animals has the correlation of creating resistance in animals. So I would say to each his responsibility. Possibly if bacteria or antibiotics are misused or overused in the human sector, well, then things have to be done about it, like we've been doing things for the past 10, 12 years. The OECD also estimates that 3 out of 4 deaths in humans can be avoided with $2 a day just by investing in washing hands. So I think that answers your question.
Some people in the animal welfare sector will say that intensive farming is part of the problem. You need more medicines because there's more intensive farming techniques. Do you agree with that assessment?
Honestly, no. I can understand that this is a perception that some people may have, but the only consequence of intensive farming is that because of the proximity of animals, if one gets sick, the other one gets sick more quickly. Like in a school or in a kindergarten, you have one child sick, it'll get the whole class sick. So that is one of the consequences of intensive farming. But per se, if you think about it, by having all the animals under your care in one place, being able to treat them together, in being able to also anticipate disease, we have a lot of monitoring, and you can better monitor your cows, your pigs, if they're all in the same place, you usually have less disease prevalence than if it's free range, they're outside, they're subject to other diseases that come from maybe wild animals. So I'm not saying one is better than the other, but it's not a direct link. Intensive farming does not mean more use of antibiotics.
And we're standing here in front of the Burlymont building in the heart of Brussels. What would you say to the EU? Is there any action that is needed at EU Commission level?
Well, I must say the EU is doing pretty well in terms of information, and they had a plan of their own for the past 5 years, and recently now they have a plan where they're incentivizing member states to also take action. Because at the end of the day, you can't be alone in fighting such a big challenge that the world is facing.